afternoon, and thank you for joining us today. My name is Maria Ariano, and I'm a member of the clinical resource team here at PointRight. And I am joined by my colleague, Janine Savage, who is our Vice President of Product Management. You know, Janine, you and I have been in this long-term post-acute nursing roles for many, many years, and we've seen so many changes during our careers. And while some things remain the same, working in this industry today has some really tough challenges for leadership. I know that when I talk with administrators and directors of nursing, they talk a lot about what keeps them up at night. Their concerns include accurate reimbursement, being left out of preferred provider networks, documentation to support their billing, and not being sure if they have real confidence in their data due to significant turnover. So that's kind of what I'd like to focus on today for our demo, and share how PointRight can help nursing facility leadership deal effectively with these challenges and hopefully get a good night's sleep, and without worrying about their data.
Yeah, absolutely. I know when I was VP of Operations and later Corporate Compliance Officer, those were definitely the things that kept me up at night. So at PointRight, our solutions have been designed with those concerns in mind, and for all users at all levels of the organization.
So as an administrator or a director of nursing, how does PointRight help ensure data integrity and give these facility leaders confidence that their MDSs are accurate for all that follows, such as reimbursement, publicly reported quality measures, etc.?
Absolutely. Well, it starts with ensuring that the MDS is as accurate as possible, even before it's submitted to CMS and before it's used for any billing purposes. So our data integrity audit, or DIA as we call it, goes far beyond a data scrubber or a basic MDS validation check like you might get within your EHR. Our DIA audits each MDS for accuracy before submission to CMS and for compliance with, from a clinical and a regulatory perspective, from a financial and a risk management perspective. Each MDS is checked for clinical and logical consistency and coding accuracy, with recommended areas to evaluate and check before completing the MDS process and submitting that assessment. And it even gives some suggestions for how issues might be resolved. So this helps our clients really achieve accurate PDPM reimbursement, also accurate quality measures, and it improves the interdisciplinary care planning process as well. In fact, our facilities even have better survey outcomes. Those using DIA have an average of 12% fewer total deficiencies, 37% fewer substandard quality of care deficiencies, and 36% fewer widespread deficiencies, which is pretty powerful in terms of outcomes. So let's take a look at some of the feedback our users see within the DIA solution. Here I have a PDPM assessment. This is a 5-day assessment. And you can see that I have a few issues here with coding consistency. I've identified here a coding error. Here's a coding inconsistency specific to PDPM. Here's a coding inconsistency related to pain medication and the pain interview, potential inconsistency. Here's an interesting one for PDPM. This resident is receiving a mechanically altered diet, yet they don't have swallowing disorder indicated. Now that could be true, but it's something that should be reviewed by the clinical care team. And then a solution or a resolution to this issue is selected. Either perhaps the coding is incorrect, in which case the user clicks change MDS, or maybe the coding is correct. The team has reviewed it and the documentation and it's correct. The reason that the explanation can be selected, and then the documentation complete box is checked off as just a second check to make sure that that documentation is present in the medical record should you need it. Here's another coding inconsistency that's important from a compliance perspective. This is a resident who's receiving speech therapy with no typical impairments that we might see as an indication for that. Impairments in communication or a swallowing problem or certain diseases. So that's just another checkpoint to make sure that medical record documentation is consistent and the team is kind of all rowing in the same direction. So those are some helpful issue alerts. And also from a PDPM reimbursement perspective, here's a complete comprehensive picture of how this assessment looks from a PDPM reimbursement perspective. So the team can make sure that that assessment is reflecting the care that's been provided and that they expected to see from a reimbursement perspective. And also there's a picture here of how therapy has been delivered, even though we know that's not used specifically for reimbursement in the PDPM system. It is something that's being monitored by CMS and others. So you can see how therapy is being delivered. There's also coding details that some of our facilities use as part of their triple check process and their weekly or bi-weekly even Medicare meeting that shows exactly how all of these key drivers of PDPM reimbursement were coded. So that's very helpful as well. And then from a facility perspective, we can look at the insights that we have about PDPM throughout the facility based on all of our assessments. And you can see this is a dashboard and there are 4 tabs here. The first one is payment analysis. So here we have the average per diem rate and how that's changing or not changing over time. All of these visualizations are exportable and printable. They also have details pages available. So here on the average per diem rate, there's an actual list of the resident assessments that comprise this, and these are printable as well. So we can see here throughout this dashboard, there are some really key visualizations. In the case mix analysis, we show the distribution of each component, as well as the key drivers in the areas that are really behind those outcomes. So here for the SLP, it's patient characteristics. You can see how your facility looks compared to a PointRight national benchmark. Similarly for the nursing component, we have the nursing function score, for example, and nursing characteristics. This is kind of interesting. This facility has 0% extensive services. That's something that they might want to take a look at. Similarly, they're over twice the national benchmark in terms of identifying depression. So those might be, processes that they might want to take a look at. The NTA comorbidity score. This facility has no scores for this particular month that I've selected over 8. So they might want to, as a team, take a look at those NTA comorbidities and just make sure that they are capturing everything that they're actually delivering and those conditions that the residents have. We also show interrupted stay trends over time and interim payment assessments. And again, those have drill downs. And a picture of how therapy is being delivered. Again, from a compliance perspective, this is important. Here's the % of assessments with minutes in PT, OT, and speech, and the average number of days across those assessments, and how the therapy is actually being delivered in terms of the minutes.
Well, thanks, Janine. And other key roles in an organization are the regional, clinical, and reimbursement type managers. What tools help these folks stay on top of all of their facilities, especially now while we're all trying to evaluate the transition to PDPM and focus on maintaining good clinical outcomes during this pandemic?
Yeah, absolutely. So all of the PointRight solutions, including PDPM, have specifically designed enterprise-wide views, and we have analytics at each group level within the organization. And that's something that we work with our organizations to set up in terms of their hierarchy structure. So all of the groups, whether it be regions or divisions or whatever the groups are within your organization, are represented. And we have group level reporting and analytics and visualizations at each of those levels. So here we are in the group level PDPM Insights dashboard for our demonstration organization. You can see it looks very similar to the facility level. And the drill downs here, where we had facility to resident level drill downs at the facility level, here we have group level to facility level drill downs. And actually I chose this is our demo. Organizations are always interesting because you might not have absolutely current data loaded. So here we go. And you can see here I have facility level information for each of these visualizations. Also, a really nice feature we have at the group levels is a one-click Excel export. And when you click this Excel button, there's an export that opens on the fly, and it contains all of the information from throughout the dashboard for all of the facilities, which is really nice to have all in one place. So you can look across your facility outcomes here, and you can use this as source data for other purposes as well.
Fantastic. You know, we do so much more at PointRight with the MDS data. Can you share what other insights are available?
Absolutely. Let me change back here to the facility level. So I think you saw when we were at the facility level, we have, this is our landing page. It's an executive dashboard with some key metrics from throughout the organization. These are, or throughout the facility, I should say. These are customizable. The user can move those around. So in addition to the data integrity audit components and the PDPM Insights dashboard, we have our Radar product. The Radar solution is a care management tool with resident level descriptive and predictive analytics that identify risk for adverse events, falls, pressure ulcers, hospitalization, mortality, and return to the SNF, and also levels of impairment, ADL, cognition, mood, pain, and also a discharge complexity measure. So that includes MDS related details for care planning. There's a comprehensive resident summary, and our proprietary predictive analytics, provide the care team with patient level data to know who's at risk, how great that risk is, and if that risk is increasing. So that helps them with their care planning, and also population level analytics within Radar to help them with their performance improvement. Our PointRight Pro 30 rehospitalization is the only all-cause risk-adjusted rehospitalization measure that's NQF endorsed. It was validated by Brown University and adopted by the American Healthcare Association. And we have a variety of analytics available for rehospitalization, including different payer types and clinical cohorts and risk levels. We show trending over time, a resident level view so that you can see who's actually been rehospitalized, readmitted to the hospital, and do root cause analysis at that level, as well as incorporate these outcomes measures into the quality assurance and performance improvement program within the facility. Our quality measure toolkit includes both real-time quality measures that we calculate based on the most recent near real-time data, and CMS reported quality measures as well. So the real-time quality measures are really important because it will help you improve quality way before you can see anything that's been reported by CMS, of course. And it includes a resident level drill down and various components, including trending over time. Many of our facilities entirely stop using any CASPER reports because there's no need to pull their CMS CASPER reports. The group level for quality measures also includes a one-click export of all quality measures for all facilities. So that's a really handy thing to do for monitoring purposes as well. Our 5-star fast track solution. This is a proactive and interactive monitoring solution for 5-star. It also has a what if functionality. So you can set targets for your improvement efforts and see where you might be if certain drivers of each domain were to change. You can also look at your more current quality measure performance and see where you would be given that more current performance. And the other thing I'll mention is our PointRight 360 scorecard solution has predictive and descriptive analytics in order to compare groups of skilled nursing facilities nationally, regionally, locally. You can look across all of your facilities within your own organization. You can look at your facility compared to your peers and competitors in that same area, and in a number of ways. And that's used by SNF providers as well as post-acute care stakeholders like ACOs and REITs and health systems.
Great, thank you. You know, there's one last thing that I wanted to share, and that is really our unmatched customer service and support that PointRight provides. You know, if you take a look at the help menu, you'll see several ways that we support our clients. And, you know, the first one is the questions and answers. It's in-app question and answer. So your team has access to our long-term post-acute care clinical expertise throughout the day. They can ask specific coding questions, regulatory or product related questions, and one of the clinical team resources will assist you within the application. And we also have the online training. This is an in-app resource with resources such as training materials, user guides, videos, etc., as well as our contact us option to reach support if you prefer to speak with a live person, or you can always call our support line. So with that, we'd like to just go ahead and open it to questions and answers. And it looks like we've got a couple here. So first question, Janine, is do I have to install any software?
No, our solutions are a software as a service model. So there is no software to install, and you just need a web browser.
Fantastic. What has been your feedback so far from your customers on your PDPM tools?
Very positive overall. And I would say that, you know, some of the features that they really appreciate are the ability to see the real drivers of reimbursement. First at the assessment level, which is kind of where, of course, it all starts, at the individual assessment level. And then also to see the insights, you know, throughout the facility, and to see, you know, some of those things that I showed earlier in the case mix components about what's really driving their reimbursement and what systems and processes they might want to review. We've gotten a lot of feedback about the value of being able to compare their outcomes to a benchmark and kind of know where to look. Of course, we always tell people that outliers are usually meaningful and are the places to start looking. So that's been really great feedback to hear that they're really interested in that. One of the other features that they really like is the top 10 ICD-10 codes. So here we can see the top 10 ICD-10 codes for a given time period that are the primary clinical, driving the clinical category for PDPM. And some of the feedback we've gotten is that there have been some surprises that facilities have seen compared to, you know, what they had maybe expected. And of course, you know, we're now seeing quite a bit of the COVID ICD-10 code, unfortunately.
Yeah, absolutely. Next question that just came in your 5-star product, can I put in my new additional surveys that might come in, or we just got a complaint survey? I'd like to see how that would impact my my nursing inspection.
Yeah. Absolutely. So in the what if features of the 5-star solution, you can add a new survey cycle. So if you've just had a recent survey and you want to kind of project what you'll be getting in terms of deficiencies, you can add that cycle and enter those deficiencies and see how that affects your 5-star rating. You can also add a complaint deficiency. So if you got one of these, just pick something randomly, you can recalculate cycle 1 and see how that would affect your health inspection score and how that would roll up and affect your 5-star rating. So yes, absolutely.
Very good. And looks like go one more. How can I learn more? I'd like to get a little bit more in-depth demo. Is that possible?
Absolutely. So here on our website, PointRight.com, you can request a demo just by clicking this button here at the top. Also, I'll mention there are some really great resources available here. So we have, some PDPM information and lots of information for you to explore here as well. And our CEU webinars, which are not just for our clients, they're open to everyone. We offer at least one CEU bearing webinar each quarter with credits for administrators and nurses.
Very good. Well, that looks like that's all the questions. Thank you all for joining us today. You will be receiving an email with today's recording. So we'll send it to all of the attendees. So if your team members weren't able to join us today, please feel free to share that within your organization. You'll also be getting a resource to help you with a PDPM self-evaluation. So again, thank you so much for taking the time to meet with us today, and have a wonderful day.
Thanks, everyone.